friends, welcome back to the fourth episode of AIAPGET 2020 video mock test series by Friend of Health. So in today's episode, we'll be seeing 10 questions from dermatology. Dermatology is a very important subject as far as AIAPGET is concerned, and around 1 or 2 questions are sure in every question paper of AIAPGET. So we'll be seeing some previous questions from AIAPGET, UPSC question papers, and also 4 questions which can come in this year are added. So in this episode, 10 questions from dermatology will be there. Try to answer the questions in the comment box or in a paper. The method for answering I have already told in the previous video. You can pose the questions and try to answer. In the answer key discussion session, we have tried to give the references from authentic textbooks, and also will discuss many more related questions from dermatology. Tables, pictures and high-yield topics from authentic textbooks like Davidsons and K.Park community medicine textbook are added. First question. So always keep an eye on the timer and the changes which are happening in the question palette area, and try to imagine the way you are going to answer this question, which option you will be selecting, the save and next, the save and mark for review, or the mark for review and next, or just the skip the next button. So always keep imagining how you are going to do, then only this mock test, this video mock test series will be fully beneficial to you. So the first question. A male patient presented with flat-topped papules on wrist and forearms. The lesions were extremely itchy, and close examination revealed a network of grey lines on surface of papules. The correct diagnosis is psoriasis, tinea corporis, Lichen planus, scabies. So second question, the clinical variety of psoriasis which is most common in children and young adults is palmoplantar psoriasis, plague type psoriasis, gutted psoriasis, pustular psoriasis. Gottron's sign is found in patients of psoriasis, lichen planus, dermatomyositis, discoid lupus erythematosus. Fourth question. A 18-year-old college student presented with erythematous itching lesions on the wrist. On examination, papules and vesicles were noted in a band-like pattern around wrist along with oozing. The most probable diagnosis is seborrheic dermatitis, herpes simplex, contact dermatitis, urticaria. The fifth question. A 15-year-old girl gave a history of well-defined small circular pink scaly lesions on her back, followed by widespread papulosquamous eruptions, typically arranged in symmetrical tree-like pattern on trunk. There was no lymph node enlargement and no oral lesions. The most probable diagnosis is tinea versicolor, Pityriasis roseae, Lichen planus, pemphigus. Now the sixth question. A positive Nikolsky sign will be found in case of Lichen planus, psoriasis, pemphigus, SLE. Question number 7. A 24-year-old female has flaccid bullae in the skin and oral lesions. Histopathology shows intraepidermal acantholytic blister. The most likely diagnosis is pemphigoid, erythema multiforme, pemphigus vulgaris, dermatitis herpetiformis. Question number 8. A 22 years old male patient presents with a complaint of severe itching and wide scaly lesions in the groin for past 1 month. Which of the following is most likely to be the causative agent? Trichophyton rubrum, Candida albicans, Candida glabrata, Malassezia furfur. Ninth question. A 22-year-old woman developed small itchy wheals after physical exertion, walking in the sun, eating hot spicy food, and when she was angry. The most likely diagnosis is chronic idiopathic urticaria, heat urticaria, solar urticaria, cholinergic urticaria. Now the last question. A 16-year-old student reported for the evaluation of multiple hypopigmented macules on the trunk and limbs. All of the following tests are useful in making a diagnosis of leprosy except sensation testing, lepromin test, slit smears, skin biopsy. So you can see the changes in the question palette which happened. So 10 questions are attempted or answered, and the changes in the palette, and the timer is almost exhausted. Now we will see the answer key, and answer to each question will be mentioned. Also in detail it will be analyzed from the source books like the authentic textbooks like Davidson and community medicine textbook by Park, so that we will get to know from where the questions are framed. Also the possible questions for this year, more questions other than these 10 questions will be discussed. So don't skip this answer key discussion part, it is very, very important. So the first question was, a male patient presented with flat-topped papules on wrists and forearm. The lesions were extremely itchy and close examination revealed a network of grey lines on surface of papules. The correct diagnosis is, so psoriasis, tinea corporis, lichen planus, scabies are there in the answer. So you can see the question once again. These kind of questions are nowadays very common. So a case like question will be there. So male patient, flat topped papules. So if you have gone through the lines of the dermatology chapter in Davidson, it is very, very easy. So answer is lichen planus. So more clues are there in the question. We'll see about the lichen planus what is given. So about lichen planus, it is given in the clinical features, like you can see here, it is intensely itchy and lesions are violaceous, shiny, flat-topped, polygonal papules with a characteristic fine, lacy white network on the surface, that is Wickham's tray. New lesions may appear at sites of skin trauma, Koebner phenomenon. So all these are very, very important and frequently repeated questions. So if you see the question again, so flat-topped, then extremely itchy, then network of grey lines on the surface of papules. So many clues are there, so we can confirm the answer and just move on. So if you have read the chapter properly and if you have highlighted, you can easily answer and move on, and you can save this time for other questions. So that's all about lichen planus. So always go to textbooks like Davidson's textbook, that is authentic textbook. And the next question, the clinical variety of psoriasis which is most common in children and young adults is palmoplantar psoriasis, plaque type psoriasis, guttate psoriasis, pustular psoriasis. So always keep an eye on the changes happening in the palette, question palette. So 8 questions are not visited, 1 is already answered, and we are in the second question here. The answer is guttate psoriasis. If you see the Davidson again, the 29th chapter, the dermatology chapter, in the psoriasis discussion session, you can see plaque psoriasis, guttate psoriasis, pustular psoriasis. So here you see the first line of guttate psoriasis itself. This is the most common in children and adolescents, and is often the initial presentation. So it is very, very much here. So you can go through the source textbooks, and interesting facts like these must be studied and made notes. Okay, so you can see the nail changes of plaque psoriasis, thimble pitting. Nail involvement is common with thimble pitting. So such things are very interesting and important. If you see gutted psoriasis again, it may present shortly after a streptococcal throat infection and evolves rapidly. So question can come from anywhere. You should be very much aware of the previous questions. Also, you should be going back to the textbook and read such interesting facts and make notes and revise it. Okay. So the third question, Gottron's sign is found in patients of psoriasis, Lichen planus, Dermatomyositis, discoid lupus erythematosus. The answer here is Dermatomyositis. And if you see again the Davidson Dermatomyositis, a multi-system disease. So if you see here, linear erythematous streaks may also be observed on the back of the hands and fingers and papules over the knuckles. Gottron's papules, that is called Gottron's sign. So you can see dermatomyositis, heliotrope, violaceous heliotrope, erythema periorbitally. So all these things are very interesting. Shawl sign, all these are previous questions also. Upper trunk, when the eruptions are there, we can see shoulder and upper trunk, shawl sign will be there. Okay, so Gottron's papule, shawl sign, heliotrope, violaceous heliotrope, erythema, all these things. So fourth question, a 18-year-old college student presented with erythematous itching lesions on the wrist. On examination, papules and vesicles were noted in a band-like pattern around wrist along with oozing. The most probable diagnosis is seborrheic dermatitis, herpes simplex, contact dermatitis, urticaria. So we can rule out many things easily, and the clues they have given is 18-year-old college student and the location, the wrist and band like. So some contact is there. So contact dermatitis. If you go back to the textbook, Davidson again, so allergic contact eczema, if you can see the box number 29.22. So one more thing, very important thing, when you read Davidson's textbook or Harrison's textbook, all the tables are very important. Even the pictures, all the pictures and the description or the short description about the picture is very important. Questions can come from there and you can easily remember this. You can memorize by seeing the picture, and very practical or clinical application of the theory what you are doing or reading. It will be given in the picture and its description, and the tables are very important. You have to read all the tables. So this is one important area. So if you see here, common type for delayed hypersensitivity allergen. So you got another question. Allergic contact eczema is which type of hypersensitivity? So here you can see allergen nickel from the sources like jewelry, jeans, stud, bra clips, watches, etc. Dichromate from cement, leather, matches, etc. So here they are given the allergen and the source of allergen. So this itself they can give as a case, like what we have seen in this question. As a case format they can give. You have to do only, you have to apply the knowledge of the theory and you have to answer. So answer is allergic contact eczema or contact dermatitis. So once again, while studying Davidson or reading Davidson and Harrison like authentic textbooks, each column, the tables are very important. So next question and the theory, you can see the classical presentation or the clinical features here. And the next question, a 15-year-old girl gave a history of well-defined small circular pink scaly lesions on her back followed by widespread papulosquamous eruptions, typically arranged in symmetrical tree-like pattern on trunk. There was no lymph node enlargement and no oral lesions. The most probable diagnosis is, so here how many clues we have? A 15-year-old girl, well-defined small circular pink scaly lesions, and location is back, and widespread papulosquamous eruptions, typically arranged in a symmetrical tree-like pattern on trunk. So these are very important and interesting things. So the answer is Pityriasis rosea. So if you see the cause and clinical features of common scaly rashes, you can see Pityriasis rosea, fir tree pattern on trunk. So the distribution is like in the trunk in a fir tree pattern. So well defined small erythematous plaques, collarette of scale. And one more important, very repeatedly asked question is from this area is Herald patch. So if you see what is Herald patch, you can see that the Herald patch is a single plaque that appears 1 to 20 days before the generalized rash of Pityriasis rosea. It is an oval, pink or red plaque 2 to 5 cm in diameter with a scale trailing just inside the edge of the lesion like a collarette. So you can see here the collarette scales. The collarette scales are there, and this is the herald patch. Okay, 2 to 5 centimeter in diameter, oval, pink. Okay, and you can see other one option, Pityriasis versicolor. So if you see malassezia for all those things, and very important, spaghetti and meatballs hyphae. The diagnosis can be confirmed. This is about Pityriasis versicolor. So this also we can expect as a question. Previously it was asked in many NEET PG exams. So in AIAPGET also we can expect Pityriasis versicolor. The diagnosis can be confirmed by microscopy of skin scrapings showing spaghetti and meatballs hyphae. Okay, all these things, interesting things, you have to make note. And the next question, a positive Nikolsky sign will be found in case of Lichen planus, psoriasis, pemphigus, SLE. So answer is pemphigus and Nikolsky sign, Gottron sign. So many signs are there in dermatology, very interesting and clinically very useful. So you have to go through this and you have to make note and revise. So if you see the pemphigus, if you see, pemphigus is less common than BP. BP means bullous pemphigoid, and patients tend to be younger, all those things. And if you see here the clinical features, if you zoom and see the clinical features, so here they are giving clearly, see, erosions are common and the Nikolsky sign is positive. So what is Nikolsky sign? If you see the blisters clinical assessment, you can see that the Nikolsky sign, the sliding lateral pressure from a finger on normal looking epidermis can dislodge and detach the epidermis in conditions with intraepidermal defects. Okay, so such as pemphigus and toxic epidermal necrolysis. So Nikolsky sign is positive in toxic epidermal necrolysis and pemphigus. So this is Nikolsky sign. So make a reading. These are very interesting and important facts. And next question, a 24-year-old female has flaccid bullae in the skin and oral lesions. Histopathology shows intraepidermal acantholytic blister. The most likely diagnosis is pemphigoid erythema multiforme, pemphigus vulgaris, dermatitis herpetiformis. So all are having a bullae or a blister type of presentation, but flaccid bullae is very, very important, and it is found in pemphigus vulgaris. You can see from the tables in the Davidson, and also in interesting books of dermatology, we can see that this pemphigus is intraepidermal, and pemphigoid erythema multiforme, dermatitis, if you take, all are subepidermal. If you see the table from Davidson, clinical and investigation findings in the immunobullous disorders, you can see that pemphigus vulgaris, flaccid, fragile, many erosions. So this is the presentation, flaccid blister, so flaccid bullae. If you see dermatitis herpetiformis, you can see that excoriated blisters or often not present. Blisters are often not present. And if you see the pemphigoid, you can see that there are tens bullae. So pemphigus vulgaris, flaccid bullae. Okay. So erythema multiforme, very, very important and very interesting fact is there in that targetoid bull's eyes eruption. Like lesions are multiple, erythematous, annular, targetoid or target lesions are found in. They can ask. So answer is erythema multiforme. So targetoid bull's eyes and may blister. So this is the presentation of erythema multiforme. You have to make further reading. A 22 years old male patient presents with a complaint of severe itching and wide scaly lesions in the groin for past 1 month. Which of the following is most likely to be the causative agent? Such questions where diagnosis is not mentioned, always diagnose the case first and try to bring all the points you know about that case. Then you can easily answer. You can diagnose this case as tinea cruris. So answer is Trichophyton rubrum. So I have already told you all the pictures and its description is important. So if you see tinea cruris case picture in Dermatology, Davidson Principles and Practice of Medicine 23rd edition, the figure number 29.26, dermatophyte infections, Trichophyton rubrum infection of the groin, that is tinea cruris. See the first picture, the picture A is speaking about Trichophyton rubrum infection of the groin, that is tinea cruris. So the answer is Trichophyton rubrum. And the next question, a 22-year-old woman developed small itchy wheals after physical exertion, walking in the sun, eating hot spicy food, and when she was angry. Most likely diagnosis is cholinergic urticaria. So such things, very interesting terms or interesting areas of diagnosis you have to study. So cholinergic urticaria. Next question, a 16-year-old student reported for the evaluation of multiple hypopigmented macules on the trunk and limbs. All of the following tests are useful in making a diagnosis of leprosy, except, so this is about the diagnostic tests of leprosy. So here the diagnosis they have given after the presentation. So these are the things to frame a question, but mainly they want to ask what are all are diagnostic tests of leprosy except. So for that they have brought in a case format. So you have to understand that soon after reading the case or the question, you should identify the focus of the question or the essence of the question. So don't waste much of your time on other things. In this question, only thing you have to know is all of the following tests are useful in making a diagnosis of leprosy, except sensation testing, lepromin test, slit mirrors, skin biopsy. So the answer is lepromin test. If you see the Park textbook, so here you can see all the questions, the 10 questions are answered, and time is almost over. So you see the reference in Preventive and Social Medicine textbook by Park, K.Park. So lepromin test, if you see the first line itself, the value of lepromin test is not a diagnostic test. So answer for all the except all of the following tests are useful in making a diagnosis of leprosy except the answer is lepromin test. So lepromin test is not a diagnostic test, but it will be useful, like the test is also grateful value in estimating the prognosis in cases of leprosy of all types. The prognostic value is there in leprosy of all types for lepromin test. So that's all about dermatology. More topics are there in dermatology, very important topics. So you need to read Davidson's dermatology chapter or some dermatology book itself. But around 2000 diagnoses are there in dermatology. But very important and frequently repeated questions you have to identify from the previous questions. And you can answer dermatology 1 or 2 questions if they ask. You can very well answer, and many of the students who have not prepared well will not answer, so that you can top over them. So all the best wishes, and give your valuable feedbacks and suggestions about these videos, and watch all the previous videos related to AIAPGET and the video mock test series. So and suggest for your friends, share with your friends. Thank you. We'll see the next episode will be about cancer, very important topic, and nowadays in every exam, competitive examination of homeopathy, we can see a lot of questions from cancer. So next video mock test series will be about cancer. So stay tuned for the next video. Thank you once again.